As modern medical advances are providing more and more avenues to prolong human life, new conflicts emerge regarding the morality of the use of these medical interventions. Families today are facing difficult decisions about end-of-life care, especially about when to stop treatment or artificially administered nutrition and hydration. Texas law has several fundamental flaws that are contrary to Catholic teaching. These flaws allow for the premature withdrawal of food and water against patient or family wishes and allow physicians to institute do not resuscitate orders without patient or family knowledge. For that reason, the Texas bishops are seeking reform of the Texas Advance Directives Act. The Texas Advance Directives Act was passed in 1999. It established processes for families seeking advanced planning or to create advanced directives for their end-of-life care. In addition, it created specific rules for families and healthcare providers navigating difficult disagreements over end-of-life care. This is known as the Ethics Committee review process. The process provides guidance when disagreements arise between patients and families and their physicians regarding life-sustaining treatment. The Texas Catholic Conference of Bishops, along with Texas Alliance for Life and Texas Right to Life, supported the passage of the bill. It was seen as a compromise with the Texas medical provider community over the appropriate balance of protection between patients and providers. The bishops supported it as incremental legislation to improve both the autonomy rights of patients while continuing to provide appropriate protection for the rights of providers. However, since its passage, St. John Paul II has clarified the Church's teaching on basic care due to sick persons related to nutrition and hydration. In light of this and other serious flaws, reform is needed now. Under current law, there's an Ethics Committee review process to review the decisions of physicians when they are in disagreement with a patient or family member. The law uses the term surrogate to refer to the person, typically a family member, who is responsible for the medical decision-making of a patient who is not competent to make decisions for themselves. The use of the Ethics Committee review process is limited to patients who are diagnosed as terminal or who have an irreversible condition. In Texas, a diagnosis of terminal means that a patient is not expected to live beyond 6 months, even with all available treatment for their condition. Under the current law, if a physician and patient or surrogate disagree over whether or not to continue life-sustaining treatment, the physician can make an appeal to an ethics committee to review his decision. The family is typically provided with 48 hours notice of the ethics committee meeting and has 10 days after the meeting to transfer the patient to another provider if the family disagrees with the ethics committee's review of the physician's decision. If the ethics committee disagrees with the physician's decision to withdraw treatment, then the physician can face civil and criminal penalties for withdrawing treatment against the recommendation of the ethics committee. In these cases, the physician is required to continue providing the treatment until the family can find an appropriate transfer or makes a different decision regarding treatment. While the physician is the one who ultimately makes the decision regarding treatment, the ethics committees who review these decisions grant the physician civil and criminal immunity if they agree with the decision the physician makes. However, there are no guidelines in statute to guide this review process. The Texas Catholic bishops are seeking reform of the Texas Advance Directives Act because of several fundamental flaws in patient autonomy. Next, we'll be reviewing some of these flaws and the specific reforms that the Texas bishops are seeking to address them. Current law identifies artificially administered nutrition and hydration as life-sustaining treatment, rather than recognize it as the ordinary basic care due to any human person. As a result, artificially administered food and water can be withdrawn from patients prematurely when it still has the ability to nourish and sustain a patient's life. In seeking reform, it is important to clarify that nutrition and hydration should generally be provided to patients throughout the treatment process, even as life-sustaining treatments are withdrawn. However, there does become a point in the dying process when the provision of artificially administered food and water can actually become harmful or be ineffective. It is at this point that physicians, families, and sometimes even ethics committees should review the specific case. The Texas bishops support putting into the law some criteria to guide this decision-making process in order to protect patients for whom artificially administered food and water is still beneficial, while at the same time preventing some of the complications that arise when the body can no longer process or metabolize the nutrients and hydration. Such exceptions allow for the removal of artificially administered nutrition and hydration when the nutrition and hydration hastens the patient's death, is medically ineffective in prolonging the patient's life, when it seriously exacerbates other major medical problems, or results in substantial irremediable physical pain or discomfort, and the medical problems and discomfort outweigh the benefit of the treatment being provided. The next area of concern in Texas law is the Ethics Committee review process. While the bishops support the Ethics Committee review, there are certain areas of the process that could be improved. The current review process lacks adequate protections for patients and families who are going through the process. For example, when a doctor and a patient or patient's family disagree about ending life-sustaining treatment, only the doctor has the option of presenting the disagreement to the Ethics Committee for review. And then the 48 hours notice of the meeting given to the family is not sufficient time to make travel arrangements to come and attend the hearing or to process the feelings involved. In addition, the 10 days notice for a transfer after the meeting concludes doesn't always allow enough time to find a facility to handle the patient's needs. There is nothing in the law that provides criteria by which the ethics committees can review the decision of the physician to withdraw treatment. This can result in subjective decisions. One of the ways to improve the ethics committee process is to extend the amount of time involved. By allowing for 1 week's notice of the ethics committee review meeting, families have more time to prepare to attend the meeting and prepare themselves for it. In addition, we would like to see a moderate extension of the period of time families have to seek a transfer to another facility once the physician and ethics committee find that the medical treatment is inappropriate. We cannot support an unlimited amount of time for this transfer because the medical treatment being provided has ceased to become treatment at this point, and it could constitute a therapeutic abuse of the human body. We have to continue the rights of providers not to provide medically inappropriate treatment simply because the family requests it. Reforms to the process are needed in order to ensure that people living with disabilities are protected from premature withdrawal of necessary life-sustaining treatment, but also protected from being forced to endure burdensome or non-beneficial treatment. By providing clear criteria by which ethics committees can sustain the physician's decisions, we can ensure that the treatment is only withdrawn at a point when it is harmful to the patient or ineffective in saving the patient's lives. In addition, allowing the surrogate to attend the meeting and bring others for support can help to be sure that their viewpoint is expressed as this process goes forward. The information required to be provided under the current Texas Advance Directives Act is minimal. This leaves families feeling overwhelmed by the ethics review process. While they can request a patient record, access to it is slow and costly. Overall, there's no required reporting that allows us to track the outcomes of the Ethics Committee review process and determine how often hospitals or even individual doctors are using this process. Improvement should be made by appointing a patient liaison at the hospital level who is familiar with end-of-life care issues, hospice options, and can help explain the basic ethical principles involved. This patient liaison increases the communication flow and provides for a more compassionate communication between the family and the facility when there is a disagreement over treatment. Surrogates and families should be allowed to request and receive a free copy of the patient medical record that they can receive in advance of the Ethics Committee review meeting. In addition, it would be very helpful if there were basic reporting to the State Department of Health Services to determine how often hospitals and even individual doctors are using this process so that we can better track the outcomes to improve things moving forward. In Texas, there are no specific requirements in law regarding when a physician can issue a do not resuscitate order. While a person can request a DNR order, there is nothing that explicitly requires that they be notified or that they consent for such an order when a physician writes one on their own. Therefore, there is no official opportunity to appeal a do not resuscitate order, even in the case of a competent patient. While many people are familiar with the term DNR, it isn't the most accurate description of this medical order. Attempted CPR is an active intervention that can be traumatic and cause harm, sometimes resulting in death occurring in a more violent or difficult manner. The effectiveness of CPR in reviving a patient is far more rare than most television shows depict. For this reason, a more clear term would be a do not attempt resuscitation order, as the medical professional's attempts at CPR are the subject of the order rather than the effectiveness of their attempts. Healthcare facilities should be required to provide patients and families with written notice of their policies on attempted resuscitation. Some have proposed that DNAR orders require the consent of patients or surrogates before they can be issued. In the case of a competent patient, a DNAR order should never be issued without their consent. Before placing a DNAR order in a non-competent patient's medical record, the physician or the facility's personnel should make a reasonably diligent effort to contact a surrogate. As these complex medical cases unfold in emergency rooms, it may not always be possible to locate a family member to consent to the order, so there must be exceptions in cases of unconscious patients for whom no surrogate can be located to consent to the order. If the surrogate disagrees with the order, then it should be immediately suspended, and the surrogate should be entitled to a consultation or review of the disagreement by the Ethics or Medical Committee. During this time period, the patient should be provided with all available life-sustaining treatment. For the last several years, the bishops have sought this reform. Unfortunately, there have been conflicts that have arisen as different advocacy groups have struggled to reach compromise on balancing the needs of patients, families, and healthcare providers. Moving forward, for the Catholic bishops, meaningful reform must respect the life, dignity, and conscience of all people involved in the process. We encourage you to join us in this effort. By joining the Texas Catholic Network, you will receive ongoing communications from the Texas Catholic Conference on our progress toward reform of the Texas Advance Directives Act, as well as other policy issues that we are working on. We would encourage you to join the network and support our Texas bishops in educating and persuading Texas policymakers on the essentialness of respect for human life and human dignity in end-of-life reform. You can join by visiting our website at www.txcatholic.org.